There we go. Good afternoon, everybody who's tuning in. This is my first live stream. I'm Dr. Katie from Graber Orthodontics, and I want to introduce you to my technical specialist.
I'm Mikey.
My 10-year-old
Not from Graber Orthodontics.
My 10-year-old son, who is really excited about helping me set up this YouTube live stream today. And I have a couple questions that I'm going to answer to address our Mother's Day question, which was, what do moms want to know about ortho? And me, Dr. Katie. So the first two questions are actually from patients. They weren't tweeted, but they're actually from patients. And the first question is, Dr. Katie, what do you like to do in your spare time? I'm very flattered that you all are interested, and I do love to spend time with my family. I have 2 kids and a husband and sisters and parents, and so I love spending time with them. I also love to read. I love reading books and have since I was a kid. Before books were available on some sort of device, I actually used to read regular books, and I would get in trouble for staying up too late with a flashlight, trying to read extra minutes after lights out time. The second thing that I really like to do is I really like to exercise. My favorite type of exercise is to do spinning, which is, for those who don't know, is riding a bike, which is stationary, in a group of a bunch of other people riding stationary bikes together, listening usually to very lively music. I really do like to exercise, and it's great for fitness too as well. The second question that I have today from my patients is, Dr. Katie, do you have kids, and how many do you have? And yes, the answer is I do have children. That's my other job other than being an orthodontist, is being a mom. It's a fabulous job. And I have 2 kids. One you've just met, Mikey, he's 10. He's in 4th grade at Kipling Elementary School in Deerfield, Illinois. And then I also have a daughter who's 5, and her name is Bree. And she is in preschool. So she will be in kindergarten next year. The other questions, he's showing me myself on YouTube on his phone. Very exciting.
Very exciting.
So now let's talk a little bit about ortho. I'm broadcasting here from my house, so I apologize for the light changes. Looks like the sun's going behind the clouds. The first question that I have here is, when should I see an orthodontist? So there's actually really 2 big key answers to this, and I believe that the question was from a mom about their youngster. And generally, the American Association of Orthodontists recommends that the orthodontist do an early evaluation at age 7. Now, age 7 is a dental age, so that's kind of weird, but the thing about it is that at that age, we're developing teeth, and we're actually still going through some growth phases. About 2 in every 10 youngsters need what is called early treatment. And what you might see is you might see an overbite, which is the top teeth over the bottom teeth too much, meaning the top teeth are a little bit in danger of breaking. You might see a crossbite, otherwise known as a scissors bite, where one side is biting off to the side. You might see an underbite, where the lower jaw structure is actually biting in front of the upper jaw structure. Maybe there's a habit that's been difficult to break, maybe a pacifier that's still being used, or a thumb habit, or a finger sucking or tongue sucking habit. Those are things that are best looked at early. Extra crowding where teeth can't grow in properly, or extra amounts of spacing where we're not quite sure if the right teeth are being lost, or maybe is there not a permanent tooth underneath there. Those are things that the orthodontist can evaluate. If it just looks like your youngster's teeth don't fit together, the top teeth look totally different than the bottom teeth, and you're just really not sure, go ahead. It's a good time to bring them to the orthodontist. They might not need anything, but the best thing that you'll get is some peace of mind as to knowing what's occurring at that time and what to expect for the future. The second part of that question is, when should I see an orthodontist? Is we see adults all the time. In fact, our practice, 4 out of every 10 patients is an adult over the age of 18. And so we see lots of adults. About 74% of the US population that are over 18 actually has a bite problem that needs orthodontics. So that's 3/4 of the population. So if you're worried about anything with respect to your teeth, about how they look, how they fit, if your teeth are healthy enough, definitely come in and see the orthodontist and we can take a look. The secondary question that goes along with that I got was, can parents get braces? Can parents get Invisalign? And yes, the answer is yes, we do braces and we do Invisalign. The majority of our adult patients elect to use Invisalign, but we also do have some patients who prefer to have glued-on braces, whether they be miniature metal, clear braces, or hidden braces that live on the inside surfaces of the teeth. We actually specialize in all of those things, and we do work with a lot of adult patients, even those patients who are working on restoring their teeth. Maybe they've lost some teeth in the past due to losing teeth from cavities as a youngster, maybe not having enough fluoride when they were growing up, or they've been in some sort of trauma or accident where some teeth have been lost, or just naturally some teeth didn't develop. And we do orthodontics in conjunction with the dentist in order to have a better outcome in the end, where the teeth are in the best position that they possibly can be. Why should I see an orthodontist is one of the questions that I get. An orthodontist is a specialist, and what that means is that every orthodontist, including myself, Dr. Kelly, and Dr. Graber, the orthodontist at Graber Orthodontics, we all went to dental school. Dental school is 4 years beyond regular college. So we go to an undergraduate education for 4 years, and both Dr. Kelly and Dr. Graber went to Northwestern, so they're big Wildcat fans. I went to Miami University in Ohio, and so that's actually where I met my husband. And then they go to an additional 4 years of dental school. Dr. Kelly went to the University of Illinois at Chicago, and the other Dr. Graber, as you all know, is my father, and I both went to the University of Michigan in Ann Arbor. Then beyond that, we went to an additional 2 to 3 year program. The three of us did a 3-year program specializing only in orthodontics and what we call dentofacial orthopedics, which basically means bone growth in the head and neck. And so really having a very strong focus in the appropriate and proper way to move teeth and how patients' jaw structures grow and develop throughout time. And that's why it's really important when you're thinking about alignment of your teeth to consider seeing a specialist or an orthodontist. And in our case, myself, Dr. Kelly, and Dr. Graber are the 3 orthodontists in our 2 practices in Vernon Hills and Glenview, Illinois. Next question is, are straight teeth just for looks? And that is a really great question, and a question I get a lot of times from parents. Hey, my dentist said I should see the orthodontist, but I think that, my kid looks pretty good. And most kids do look pretty good. The challenge is that a bad bite can actually cause lots of problems in the adult years. Teeth breaking down, gum and bone problems, foundational support issues of the teeth, as well as tooth loss as an adult if the proper forces of biting aren't distributed appropriately on the teeth. So straight teeth are nice, and we do consider them in our culture to be aesthetic and attractive, but the main purpose of having orthodontics is to get the bite right so that those teeth are stable and can last for a lifetime of healthy use with chewing, smiling, speaking, eating, all those fun things that we do with our teeth every day. So straight teeth, not just for looks, but actually for function and use. Another question that I got is, am I a candidate for aligner treatment? Aligner treatment, otherwise most popularly known as Invisalign, is a clear series of plastic trays designed utilizing the doctor's knowledge and a very specific technology in order to move teeth with plastic. Instead of moving teeth with braces and wires, moving teeth with plastic. And the question of, am I a candidate for aligners, is a really difficult question because I don't know who you are. And if I haven't met you, I'm not so sure if you're a candidate for aligners. But I would like to say we are the top orthodontist for adult aligners in Glenview and in Vernon Hills, in both of those areas, because most patients who come into our office who want Invisalign are candidates for Invisalign and for treatment with clear aligner therapy. So if you are worried, concerned that you're going to not be a candidate for Invisalign or for clear aligner treatment, please make an appointment, because we'd love to be able to allay your fears and get you started with Invisalign treatment if that's what you would really like to have. In fact, there are certain bite conditions, whether you be an adult, a teen, or a youth, that we actually prefer to use clear aligners versus regular glued-on metal braces. And so it's definitely something to come in and take a look, because it may even be our preferential treatment, or even something where I would say, hey, you can pick either Invisalign or braces. It's really up to you. And definitely come in for an appointment. If you're not already in treatment with another doctor and you don't have any sort of jaw joint problems, your first appointment is going to be complimentary. So it's worthwhile to come and get a look. Next question was kind of similar to that one is, do you treat kids with Invisalign? I've heard that some kids can get Invisalign. I've even maybe seen it on YouTube. And do you do that in your office? And yes, we do treat kids with Invisalign. The youngest patient right now in our practice with Invisalign is 6 years old and had previously been told they could only use an expander, which we do use expanders in our office too as well. But this youngster was a little bit too scared of an expander and was really worried that they wouldn't be able to eat or speak with it. And they were very, very concerned. They knew that they had a big problem with crowding of their teeth and that time was the right time to treat them. But they were just concerned, Kate, I'm not sure that this is something I can tolerate. So we do have young patients who I prefer to treat with Invisalign as young as age 6. And we do have patients in their 80s in treatment with Invisalign and pretty much everything in between. So you're never too old for a healthy mouth. Making teeth more cleansable and more stable will make that they last longer. And we know that there's a strong mouth-body connection. So any sort of extra overlapping or extra spacing, even in adult teeth, can cause higher bacterial counts in the body, and that bacteria can lead to some systemic problems or total body problems that become more challenging as we get older. So straight teeth are really for any age, and clear aligner therapy can really be used from all the way, in the young elementary years, all the way up to when you're a grandparent. Maybe your grandkids also get in treatment at the same time. Timing, a question that I'll get is, Dr. Katie, how long do I have to be patient with being a patient? And that's a great question. We use a couple of technologies in our office, one of which I already mentioned, which is Invisalign, and the other one is SureSmile. Both of them are software technologies. They don't think for themselves. The doctor actually does all of the treatment, but we use 3D technologies in order to reduce treatment visits, number one. So our patients save on average 8 treatment visits by using some of these technologies in order to assist the outcome of their treatment, as well as assist us in being able to visualize and diagnose problems. So that's saving time during treatment, because even for a 15-minute appointment, you still have to drive to my office. You're generally there a little bit early. You have your appointment for 15 minutes and then you need to drive home. So generally it's about an hour interference in your day. So basically during that time, you and your driver, whether that be your mom, your nanny, your aunt, your grandma, will save 8 hours of time. And as a working mom myself, saving 8 hours is a miracle. I wish I could have 8 hours back in my life, absolutely. The other question about time is overall time that you're in treatment. And so the treatment time average in our office is 16 months. The national treatment time average, as published in the Journal of Clinical Orthodontics, for those of you that want to do some research on your own, is 26 to 28 months. So we're 10 to 12 months shorter than the national average, and that's before we would use any other acceleration technologies. We also have 2 other technologies that we use in order to shorten treatment time and to make treatment more comfortable. And those technologies are a vibration technology called Accellident, which can be used with expanders, braces, clear aligners, or a combination of all of those. And the other one is a periodontal surgical procedure that sometimes we will use for adult treatment that helps strengthen the foundation of their bone because their teeth have been in a bad bite for a long time, as well as it increases the rapidity with which teeth move. So the shortest amount of time I've had somebody in braces is 12 weeks, which translates to about 3 months. So there are some quite short treatment times. And then we do have some reconstructive jaw surgical procedure type treatments that do take that kind of 16 to 18 month treatment time. So we really do have a much shorter treatment time than most of the parental generation remembers, as well as much shorter than the national average. Mostly due to the expertise that we utilize with our technologies, with SureSmile, with clear aligner therapy, and with our diagnostic procedures, which you'll see when you come in the office and as a patient probably already appreciate. The last question that I have that was sent to me was, You know, Dr. Katie, I've heard that there's certain things that I'm not allowed to eat if I start treatment for orthodontics. And that is true. The first barrier to the types of food that you eat, especially if you're 18 or under, is going to be your parents. They are in charge. They're the boss of you until you're 18. So when we think about the safe foods to eat, I'm going to mention a couple of things. It's still going to be up to your parents if you're a youngster as to whether or not that's something that you will be allowed to have. So even I, as a doctor, I'm not going to give you permission to eat something if that's something that your parents won't let you eat. But if we're thinking about conventional braces, expanders, anything that's really glued on the surface of the teeth that's got a wire or a bracket across it, there are foods that fall into a couple of categories. One that I would say, the first one is something that's really, really sticky and chewy that can get stuck in and around your braces and also is difficult to brush. Some examples would be fruit roll-ups, fruit by the foot, gummies, Swedish fish, those little red candies, right? Hot tamales, Mike and Ike's, dots. Those types of foods we would recommend avoiding. The second category, if you have something glued on the surface of your teeth, like a brace, braces, would be something that's really, really hard. Crusty breads, nuts, biting into a granola bar that's really crusty. Even sometimes a really thick potato chip, a baguette of bread, those types of things can actually put a little force against the brace as you're biting into it. And that same pressure is the pressure we use to remove the brace when your tooth is straight. So we need to make sure that those really, really hard foods aren't being chewed over the outside surface of your tooth where your braces are.
And also, don't try to remove your brace by using forces at home.
Yes.
Let my mom do it.
No at-home orthodontics, that's true. And then the last category, if you have something glued on the surface of your tooth, like a brace, is things that you bite into in the front. So some examples of those would be corn on the cob, apples, carrots, ribs, or some meat that's on a bone, like a chicken wing or something like that. Those things you can actually still eat, but the corn needs to come off the cob. The apple would be cut into little slices. You can pull the meat off the bone and eat those things. Now, if you have Invisalign or clear aligner therapy, there really are no food restrictions. You can take your aligners off to eat, and you can even chew gum without your aligners in, although Invisalign needs to be worn about 22 hours a day in order to be effective. So the period of time where you're going to be chewing some bubble gum and things like that would be a little shorter, but it is something that's possible if you're doing treatment with clear aligner therapy, otherwise most commonly known as Invisalign. So those are all the questions that I have today. So thanks for tuning in. And if there are any other questions that you want to learn about, please let us know by tweeting us at Graber Ortho. You can send in a Facebook message to our Graber Orthodontics Facebook site. You can,
also, if you're watching live now,
yes, if you're watching live,
drop it in chat and we can make this stream longer.
Yes, exactly. So thank you so much for tuning in, and I hope you have a great afternoon. Take care.